Hello everyone and welcome to sqadia.com. I'm your educator Dr. Ali Imran and today's lecture is on relapsing polychondritis. Now in this lecture, in order to outline its content, we're going to discuss about first of all what relapsing polychondritis is, how it happens, what its etiology is, what its epidemiology, how it affects different populations, which are the three main sites of its attack, and why it is very important to study even though it is extremely uncommon in patients. We will also learn about its pathology, or more specifically the histological pattern that we see in patients with polychondritis. We will also study about various clinical manifestations, from the ear-related manifestations to cutaneous ones to the joints. We are going to study about all of the clinical manifestations and how each of these manifestations move in a systematic way and why they do so. We will also learn about the nasal involvement and why nasal involvement can start from a simple stuffiness to result in a deformity, and how this symptomology works in this particular direction, and how each symptom in between works and how it affects the patient. Then we'll also learn about the various laboratory findings we find in such patients. We learn about all of these findings, which antigens are found, which complexes are found, which autoantibodies are found. We'll study all of those, what they mean, and what the typical picture in a polychondritis patient should be. Then we learn about its diagnosis and the role of biopsy in it, how the biopsy is done, where the biopsy should be taken, and what the biopsy shows in a patient with the relapsing polychondritis. Then we learn about various diagnostic tests, why we perform the CT scan, what is the importance of the MRI, what is the importance of a bronchoscopy, and why pulmonary function tests are also important. We also study about plain x-rays and why they can be even important, to the ECG and the echocardiography, and how different tests are for various different manifestations. We'll study about all of these along with the treatment of polychondritis. Now, we will not only study the drug or the medicinal treatment of polychondritis, but we'll also study the surgical component that may accompany these medical treatments, from the heart replacement to tracheostomy to the importance of stents. You can watch this lecture among thousands of other lectures relating to medical education, from topics ranging in biochemistry to anatomy to histology, embryology, to courses in rheumatology, in radiology, gastroenterology. You can find almost any medical related subject on sqadia.com. If you log on to website, you can even start your free trial today. Thank you so much for watching sqadia.com.